Hi, doctors. Welcome to our PYQ session. So, very important session. My dear damn students and other students, we are going to give you a visual treat as well as academic treat for you, the PYQ. If you attend the PYQ session, no need to worry about your preparation at all. So, enjoy and going to win their match. Okay, I am Dr. Tirunavukarasu, going to discuss all the PYQs of pharmacology. So one sample question for you. Within 1 to 1.5 hours, we are going to cover entire Goodman-Gilman with the PYQs. So we will enjoy the show on the day. Come on, look at one sample question. Look here. A patient presented with vomiting and was treated with an anti-emetic agent. Later, the patient presented with abnormal movements and posture. Which are the following agent to be used to counter the patient problem? Look at the question, doctor. Nowadays, NEETPG question are mainly concerned clinical oriented topic. So don't worry about all the things. If you're good in clinics, you can answer any number of questions. Look at this. Here, the patient treated with some anti-emetic agent followed by developed abnormality in movements and posture. That means some anti-emetic causes something called extrapyramidal symptom. That's the first point you should keep in mind before looking at the option. And then they're asking what is the drug useful for treating this abnormal posture and the position. That means they're asking drug therapy useful for treatment of drug-induced extrapyramidal symptom. Now go to option benzoxazole, levodopa, haloperidol and cyproheptadine. Now only you should know that subject. Benzoxazole, one of the centrally acting anticholinergic. Levodopa, a drug useful for treatment of Parkinson's disease, and haloperidol, a D2 blocking antipsychotic. That itself going to cause EPS, definitely ruled out. Coming to cyproheptadine, that's an antihistamine with the anti-serotonin activity. That is also not going to be useful for this case. So the answer will be either A or B. Confusion. Now look here, a anti-emetic causing EPS means it should be a D2 blocker. In the case, if you give levodopa going to become dopamine, going to act on D2. So that's also ruled out. So question answer can be option A, benzoxazole. Benzoxazole, a centrally acting anticholinergic, very useful for treatment of drug-induced EPS. Now the question starts. Which is the anti-emetic causes abnormal posture and position? That may be a D2 blocking anti-emetic like metoclopramide. Now question starts. We have two important D2 blocking antiemetic. One is called domperidone. One more thing called metoclopramide. In that, domperidone does not crosses the blood-brain barrier, whereas metoclopramide will cross the barrier, thereby risk of EPS, extrapyramidal symptom. Sometimes they cause sudden EPS, that's called acute muscular dystonia. For all cases of drug-induced EPS, the best option will be centrally acting anticholinergic like benzoxazole. Benzoxazole, also called trihexyphenidyl. It is a centrally acting anticholinergic. This option given in your question. So answer is benzoxazole. If not, we can go for promethazine. Promethazine, a first generation antihistamine having very high anticholinergic. That's also can be tried. Okay. So in this question, the culprit is metoclopramide. Problem is acute muscular dystonia. Treatment is centrally acting anticholinergic, so-called benzoxazole. In this junction, related to this, you can talk something about, for example, other than D2 blocking anti-emetic, what are the other drug may cause EPS? That means we have something called typical antipsychotic, so-called D2 blocking antipsychotic. They may cause drug-induced Parkinsonism. So, the conventional antipsychotic like chlorpromazine, haloperidol, they may cause EPS. For them, what is the treatment? So, question: there are so many type of extra symptom. One among them is drug-induced Parkinsonism. For treating this type of problem, the best answer will be centrally acting anticholinergic. What are the commonly used centrally acting anticholinergic? Either trihexyphenidyl, this is called benzhexal. The other centrally acting anticholinergic we having benztropine, biperidone, procyclin. Like that, we are centrally acting anticholinergic. Repeating, if this option not given, we can also try with promethazine. Promethazine, a first generation antihistamine with the highest central anticholinergic action, that's also tried. Now you know what do you mean by acute muscular dystonia, what do you mean by drug-induced Parkinsonism. Now just once again we will discuss other type of EPS also. There's one thing called tardive dyskinesia. What is tardive? Tardive means slow development. Dyskinesia, abnormal movements. Here the most important problem. Look at the face, look at the mouth. There is a abnormal perioral movements. They have bucco, linguo, masticatory movements. This is called typical tardive dyskinesia. For this case, the best drug, FDA approved drug is one thing called valbenazine. What is valbenazine? It's a vesicular monoamine transporter, VMAT, vesicular monoamine transporter 2 blocker. It is the latest FDA approved drug for treatment of tardive dyskinesia, a best drug. Okay. In fact, anticholinergics are not useful for this case. Best is valbenazine. Then, what are the other type of EPS? We have one thing called akathisia. What is akathisia? Akathisia means restlessness. That is urge to move. The patient will be wandering here and there, not able to sit in one place. It's a typical of akathisia. Remember, man, the most commonest type of EPS is always think of akathisia. Following antipsychotic therapy, the most common EPS going to occur is akathisia. For that case, best will be either we can go for propranolol, a non-selective beta blocker, or else currently they say clonazepam, a benzodiazepine that plays a major role. In fact, it's a first line choice for akathisia. And finally, one more type of EPS is called malignant neuroleptic syndrome, one of the dangerous type of EPS. For this case, treatment of choice means dantrolene. What is dantrolene? Dantrolene, a directly acting skeletal muscle relaxant acting on ryanodine receptor. That is a choice. Along with the dantrolene, we can supplement one thing called bromocriptine. Bromocriptine, a D2 agonist, can be supplemented. Like that, we have 5 type of EPS, namely drug-induced Parkinsonism, acute muscular dystonia, tardive dyskinesia, akathisia, and malignant neuroleptic syndrome. Like that EPS. And I told all the important treatment for all this. Like this, all the PYQs I am going to cover in my session. So please attend without fail. We DAMS providing eMedicoz for you. Enjoy the show. You must attend. If you're not studied so far, no problem. These 3 days, book in a calendar. Live for EPYQs alone. Definitely, it's going to be a game changer for you. Your life going to be very brightful, beautiful. Note it down. So, we meet on the day on PQs. That is Dr. J. Tirunavakarasu from DAMS. Thank you.